live here in Southwestern University of Finland, and today I'm going to do the assessment of head and neck. So first, we need to identify the patient. Good morning, sir. I'm your nurse for today. May I ask for your name and age? After that is I'm going to explain the procedure. So sir, this procedure will help us assess if nabakay any illness or abnormalities in your head, ears, eyes, neck, and tongue, or the oral cavity. And if ever naa is para maagapan sa bayan. After that is I'm going to perform hand hygiene. Now I'm going to assess the head and neck. First is I'm going to palpate the head or here in the skull to check if it has any lesions. Next is I'm going to inspect the face for color, symmetry, facial hair, facial expression, or if it has any lesions. Next is I'm going to inspect the eye alignment, also for the eyebrows, eyelids, eyelashes, and also here in the conjunctiva, sclera, and the pupil. Next is for using pen light.
How do you check for your conjunctiva?
Like this way. And if ever what should I call it, that needs a new. Next is for using pen light. By using the pen light is I'm going to see if pupil sa patient is very active. After that is for the pupillary accommodation and convergence is I'm going to ask the patient to focus on this object as I bring it closer towards them. So sir, can you focus on this object? Thank you. After that is I'm going to test for the eye by using the ophthalmoscope if it has any eye for the red reflex. Next is for visual acuity. I'm going to use the Snellen chart by asking the patient to stand 20 feet away from it and read or recite the Snellen chart, especially here in the small letters. So sir, can you please cover your left eye and recite here?
D, E, F, E, O, T, E.
Now the right eye, sir, please cover it.
3 letters.
D, E, F.
Now with both eyes, sir.
D, E, F.
Next is I'm going to test the eye movement of the patient by using the 6 corneal position. So sir, please focus sir and follow along. Thank you. Next is I'm going to assess the ears of the patient by first inspecting and palpating the external ears. Note for its size, appearance, or it has any lesions. Next is I'm going to perform otoscopic exam and note for abnormalities. For adult is I'm going to pull the ears up and back. And for children is down and back. Next is I'm going to perform some tests by first doing the whispers test. Can you cover your left ear, sir? And recite or iingon ko sa imong nado.
1, 2, 3, 4.
Next, sir, the right ear, sir.
4, 5, 6.
Is I'm going to perform the Weaver's and Gates test. Naka-fear or vibration, sir?
Usually,
What do you hear? Other side. After that is I'm going to assess the nose by first inspecting and palpating the external nose, and then palpate and percuss the frontal lobe and the maxillary sinuses. After that is I'm going to test for nasal patency. So, sir, can you please occlude your nostril, the left side, and then breathe in, breathe out, and then the other side, sir. Breathe in, breathe out, and then after that is I'm going to inspect the internal nostril using the otoscope. After that is I'm going to assess the ears. I'm going to assess the mouth by first palpating the geniomandibular joint. Can you please open your mouth? Close. Open. And then I'm going to perform hand hygiene. And then I'm going to put on the gloves. Then I'm going to inspect the lips, tongue, teeth, gums, and the oral cavity of the patient. So now, by using the tongue depressor, I'm going to ask the patient to please open your mouth. Can you please open your mouth, sir? Then move your tongue side to side. After that is I'm going to palpate the tongue for tenderness and also the uvula for the. Can you please say after? Thank you. After that is I'm going to remove the gloves. Now is I'm going to assess the posterior neck by first palpating here in the frontal lobe, down to the ears, back to the ears, to the chin, and here in the posterior cannula, and the lymph nodes. Next is I'm going to palpate the carotid arteries. And by using the stethoscope, I'm going to listen for the pulse here in the carotid arteries. Next is I'm going to assess the anterior neck by palpating the trachea, if not sa midline, and then inspecting and palpating the thyroid, and if naa siya right bump or something is I'm going to use my stethoscope and ask the patient to swallow, and I'm going to listen for the breaths. After that is I'm going to palpate the supraclavicular of the patient. And then I'm going to assess the neck mobility of the patient. So sir, can you please touch your chin to the chest, and chin to the left shoulder, chin to the right shoulder, and then your ears to the left shoulder, ears to the right shoulder, and then please tilt your head back. After the procedure is I'm going to perform hand hygiene and then document the findings of the assessment.